Good afternoon and welcome to NHS Wirral Clinical Commissioning Group Annual General Meeting, which is being held this year again for the second time via Teams. Although we would very much like to have been able to meet with all of you face to face, unfortunately, due to the current COVID situation, we are very mindful of our need to continue to maintain vigilance during this pandemic. Next slide, please. My name is Paula Cowan. I'm a GP locally and I'm chair of NHS Wirral Clinical Commissioning Group. I will give some slides and then pass over to my colleague Mark Chidgey, who will give us an update on finance, and then to Simon Banks, our Chief Officer, and I will conclude the meeting after that. So next slide, please. So last year via Teams we had our 2020 AGM, and since then an awful lot has happened. We have had some successes and positives. We've responded to COVID. We continue our vaccination programme, our digital agenda, inequalities, and looking at what's the future for clinical commissioning groups and what is the future for ICS and place. And all of this I will go through in the coming moments. Next slide, please. In terms of successes, I'm very, very proud of our achievements over the past 12 months and since we last spoke in 2020. And I can name many that I feel are our great successes: our system engagement, our engagement across not only our Wirral system, but the wider geography and our colleagues across Cheshire and Mersey, our positive feedback from NHS England on how we are progressing, our financial achievements, our response to COVID and the amazing vaccination programme from our PCNs and GPs. But for me, the key to our success has been the people of this organisation, those who have continued to drive our agenda forward, who have supported us through these very, very difficult times and worked in very, very unusual circumstances, and have done so with pride and a steely determination. And for all of you who work within NHS Wirral CCG, I applaud you hugely, and I'm hugely grateful for the efforts that you have made and that you continue to make during this time. Our successes are also in the achievements of our colleagues across our system and the engagement, as I said, that we've had, and mainly also the success of our COVID vaccination programme, which I'll come on to shortly. Next slide, please. Last year when I spoke to you, we were in the midst of our COVID pandemic, and you'll see from the slide here the statistics for September 2020. Despite all of our efforts and despite lockdowns, facial coverings, social distancing, COVID has not yet gone away. And COVID cases, as at the end of last week, the 7th of October 2021, were 368 per 100,000 for Wirral. So we need to maintain our vigilance in terms of how we tackle this pandemic. It hasn't gone away yet, and we are facing into a difficult winter with rising respiratory infections as well as ongoing COVID. Next slide, please. But as I said, what has been really, really positive is the vaccination programme. And our Wirral statistics as of this morning are that 83.8% of our population have had 1 dose and 78.7% have had 2 doses. We still have a long way to go, and I would encourage all of you to maintain hand washing, facial coverings where in enclosed spaces, and also maintaining that 2-metre distance where possible. The booster campaign is well underway, and the 12 to 15-year-olds are also being vaccinated. The COVID bus has been roving around Wirral, trying to opportunistically vaccinate people. And for anyone out there who hasn't yet been vaccinated, I would encourage you, please, to take up the vaccination. It is our way of helping to tackle this pandemic as we move through into winter. And again, huge applause to all of our colleagues across the system who have been very, very supportive of the vaccination programme and who've gone out of their way to really try to reach the hard to reach groups, the vulnerable people, and to ensure that everybody has the opportunity to have their vaccination. Next slide, please. A couple of areas that I want to touch on and to update you on are great successes in terms of our digital agenda. Wirral has been digitally maturing since about 2015 with the development of the Wirral Care Record and Health Information Exchange. And this is helping to support streamlining of the delivery of health and care across Wirral to you, our Wirral residents. And this enables you to tell your story only once, not having to repeat your story over and over again. That shared record across health and care ensures that clinicians and allied healthcare professionals have access to your records, which is just for health and care. And can I assure you again that this is just for health and care, that this sharing of information is to ensure that we avoid duplication and that your health and care is much more streamlined. We're now linking across Cheshire and Mersey and the Amity SIFA and the Exchange programme, as well as population health management, and working with NHS England on how we tackle particular areas of need and of clinical issues across our system. Next slide, please. Another area that we have been addressing are health and care inequalities. We know that the life expectancy differs across Wirral. Although Wirral is only a small peninsula, we see a difference of 11 years depending on where people live in our peninsula. We see great significant differences between deprivation and affluence, and we must narrow that gap. And COVID has shone a significant light on those health and care inequalities. And with that, in September of last year, we established the Wirral System Inequalities Group. This is an inclusive group, bringing together not only health partners, but also those in local authority, public health, and our third sector organisations. Listening to and engaging with our third sector organisations and having people with lived experiences is crucial in how we tackle not only the COVID pandemic, not only how we engage across our digital groups, etc., but also how we tackle health and care inequalities. We've subgroups looking at alcohol, digital exclusion, and addressing those wider determinants of health. And so we're taking this forward in order to ensure that we can really focus on how we tackle those health and care inequalities and narrow that gap around life expectancy. Next slide, please. This is a slide I showed in this time last year at the September 2020 AGM. And I put it up again because I wanted to highlight some of the key areas that we've learned over that past 12 months and how we're embracing our new normality. And the words that are highlighted and bolded are collaboration, tackling digital poverty. There's been so much push toward digital use of digital platforms, but is everybody able to engage with digital platforms? And that's something that we really need to address and are currently proactively addressing that. Working with our third sector organisations as well. And ensuring that we listen to you, our residents, you who have lived experience, and listen to what matters to you and not just what's the matter with you. Tackling system inequalities and deprivation, as I said, is a crucial and key aim for us as we go forward and across the ICS also. And system working as we face into winter, which will be a difficult winter for us, is really important. It's so crucial that we work together across our system, that we break down organisational barriers and silos and work as one in our aims to tackle all of the health issues that come to us, particularly during this coming winter. So if we now move on to the next slide, please. The future is looking very different to how it was when I spoke to you this time last year. CCGs will end on the 31st of March 2022, and Simon Banks, our accountable officer, will update you further on this in a few moments. We are part of Cheshire and Mersey Integrated Care System, and we will become more embraced in that as time moves on. But Wirral Place is crucial, localism is crucial, and working for you across our borough is our key aim over the coming years. Developing collaborative work and working on governance is our aims in the coming months as we move towards the ICS development in April of next year. Next slide, please. So in conclusion, there are many changes and challenges ahead. However, we continue to embrace that change with collaboration and system working across our Wirral Peninsula to deliver health and care for you. We have pride, and I have great pride in the achievements of this organisation thus far, but we've more to do. We want to focus on Wirral as a place, our borough, that integrated working at a local level, and then how we can link into the wider Cheshire and Mersey ICS. Last slide, please. As I said, there is much change ahead, but as we all know, there is nothing as constant except change. And so I'm going to pass over now to Mark Chidgey, who's our Director of Finance, and he will update you on our finances. Thank you.
Thank you, Paula. So if we just move to my first slide, please, the introductory slide. So as Paula says, my name's Mark Chidgey. I'm the Chief Finance Officer for NHS Wirral CCG. And before we go into the detail of this slide, I just want to remind us of where we were as we entered into 2020, 2021. So there were the significant challenges of the pandemic, of inequalities, which Paula has described to us, but there were also significant financial challenges for the CCG. And those were such that our regulators, NHS England, decided that an additional level of regulatory oversight was required. So the CCG was had been placed into what's called legal directions. So what I'm just going to take us through in our slides, in my slides, is in terms of our statutory financial duties, in terms of how we spent the funding, and in terms of the auditors' reviews and views on the CCG, what those meant in terms of those legal directions. So all CCGs have a number of financial performance standards, statutory duties that we have to fulfil. And what this slide sets out is firstly, in terms of the revenue that we receive, so a figure there of just over £665 million. That the first duty is that we're not able to spend more than that level of resources, and we achieved that. We marginally underspent. The second one then is linked to that in terms of a break-even duty, and that shows that the CCG achieved the break-even duty, and by underspending against our resource, we made a small level of surplus. In terms of the running costs, so the term running costs refers to the administrative costs of the CCG. So in terms of the money that we receive, we either spend that on administration or we spend that on patient care. And obviously what we want to do is to maximise the level of patient care. Now the running cost allocation shown there, 5.7 million, we underspent that. And what that meant is we were able to put even more resources, divert those into patient care. So that's less than 1% of the CCG's budget on running costs. In terms of our cash position, we're required to minimise the amount of cash at the year end, and that was, we ended the year with £25,000 in the bank account. So that target was achieved. And then finally, two really important standards in terms of the context of the last 12 months. The first, which is called business conduct, is about us as a CCG ensuring that we make prompt payments to our providers. And in the last 12 months, that's never been more important, to ensure that we get the cash out to the providers as they deliver care to our patients. Now, the target for that is 95% of invoices paid within 28 days. In the last 12 months, the CCG managed to pay more than 99% of invoices within 28 days. So that was a target that we really, the governing body really placed great emphasis on. And then lastly, the mental health investment standard, mental health financial performance. So what this target requires us to do is any increase in funding that the CCG receives overall, we have to differentially invest in mental health. So in 2021, that was 3.6% growth. The requirement was to spend that plus another 1.7%, so 5.3% growth. So an additional £3 million on mental health. The CCG actually spent in excess of £6 million more on mental health. So we overachieved against that standard. So across those standards, all ticks there, so all of the standards were achieved. Move to the next slide, please. Thank you. So in terms of how we spent that money, the pie chart over on the left-hand side shows the proportionate share across NHS contracts, prescribing, primary care and other areas. And there are two areas there that are highlighted in red, which I will come back to in a moment. So we saw quite a significant change in distribution of the funding in 2021. Now, if I just take you to the table on the right-hand side, the first column shows how much we spent in 1920, the second in 2021, and then the change. So we can see that in total, the CCG spent an additional £85.1 million. that in terms of our running costs, so that administrative cost area, we actually spent less in 2020-21 than we did in the previous year. And therefore, all of the increases in that area of programme. Now, there were two significant changes that I would highlight within 2021. The first is that the CCG became what's called the Delegated Commissioner for Primary Care. So we took on the responsibility for the contracts with our GPs, the national contracts with GPs, so GMS and PMS contracts. And what that meant is that 52.1 million of that increase is actually a scope change rather than a differential increase. And the other category that I'm highlighting relates to our spend in response to the COVID pandemic, so an additional £13.5 million there. Now, the spend on the Wirral population will be much greater than that, but significant elements of funding went directly to, for example, the acute trusts. So this spend, the money that came directly to the CCG, enabled us to establish primary care hubs. So safe services for patients who were COVID positive to continue to be assessed and receive primary care, and also additional capacity in care homes to ensure that we had a rapid and safe flow of patients to be discharged from hospitals. So if we move to the next slide now, please. So across the year, there were a number of internal and external audit reviews of the CCG's finances, and in terms of the outcomes that I've listed here, in terms of substantial assurance, full assurance, non-qualified opinions, those are the highest levels of assurance that the CCG will be looking to achieve. So those were in the financial systems of the CCG, so in terms of all our various processes about how we manage the money. In terms of primary care audits, so as a newly delegated commissioner, that was a really important audit for the CCG and confirmed that we had the right processes and controls in to manage that funding. In terms of our COVID expenditure, again, substantial assurance in that area, so in terms of how we were spending and how we were recovering that money from NHS England. And then finally, our external auditors reviewed the mental health investment standards, so the achievement of that standard on my first slide. So they reviewed and confirmed that the CCG had correctly accounted for that funding, and also our annual accounts and report for 2021. So again, an unqualified opinion is the outcome that we would want from our auditors. So moving to the final slide, please. So I started my presentation by confirming that the CCG started the year in legal directions. Now, because of our achievement of performance, because of the outcome of those audits, we were really pleased that in May of this year, NHS England confirmed that the CCG has been removed from legal directions. So in an incredibly challenging year, a really good outcome for us from a financial perspective. Then we move to my final slide, please. Thank you. So looking forward into 21-22 and beyond, then obviously we need to continue to prioritise our resources to meet the health needs of the Wirral population. So that means, our continued response to COVID. It means continuing to prioritise mental health services, ensuring that access to be it primary care or elective care or urgent care, so our population has good and improving access. And across all of that, as Paula highlighted in her slides, the issue of addressing and reducing inequalities across our population. Again, as Paula highlighted, and Simon will tell us some more about in his presentation, continuing to work with partner organisations, both in the way we do now, but also through what will be the newly formed Integrated Care Board. So that will mean that we continue to work both at Cheshire and Mersey level, but really importantly, continuing to work at Wirral as a place. And finally, as we've been able to evidence in this year, maintaining our financial control and delivery of all of our financial performance standards, and that absolutely includes addressing the recurrent deficit. So the recurrent deficit is 14.9 million, and we make a non-recurrent contribution to a system deficit of £10 million. So improving that underlying position is something that we will progress during 21-22 and beyond. And with that, I just say thank you and pass on to Simon.
Is that working now? Right, thank you. We had a bit of a technical problem with the settings on my computer. Sorry about that. Okay, so I'm Simon Banks. I'm the Chief Officer of NHS Wirral CCG. And looking back on 2020, 2021, clearly the last few months have been absolutely dominated by the response to COVID-19, and we've been in a permanent state of an incident response since March of 2020, and we're still in that incident response at the moment. COVID has not gone away. It's still present in the population, and we still have some of the highest rates of infection, in fact the highest rates of infection in Europe, and still people are dying daily from COVID. So that has really coalesced what we've done as an organisation, as part of the whole system. And the last year has been exemplified for me by absolutely making things happen when they needed to happen, to make sure that the governance we had in place ensured that we did things safely and within the rule of law, but also that we acted as Team Wirral within that command and control situation, and did things together in tandem with the local authority, the acute trust, community trust, partners in general practice, and indeed partners across the whole system, particularly providers of care and the voluntary sector. And this an annual general meeting is obviously about looking back, and later we'll also do a bit of looking forward. But much of what we've done is documented in the annual report, which I'll refer to, but also in the governing body papers that are on our website. And one of the things we've managed to do, I'll come on to in governance terms, is maintain our governance, maintain our governing bodies through this period. Moving on to performance versus constitutional standards, many of the constitutional standards were suspended because of COVID-19, such as measuring delayed transfers of care, looking at how many elective procedures have been cancelled, and also monitoring the utilisation or reducing the delays, breaches of mixed sex accommodation. We still monitored through this period our performance in terms of cancer pathways, referral to treatment times, waiting lists as a whole for elective care, accident and emergency performance and ambulance response times, as well as adding in additional activity and monitoring around NHS 111. By doing that through the pandemic period, this has allowed us to look at where our baselines and where we need to move in terms of the recovery challenge that we do have. And we have a recovery challenge across all those areas. We've had this week one of the busiest days in accident and emergency department that Wirral has ever seen. People are going to ED, and ED is not always the best place for them to go. So we're looking at ways in which we can reduce people's footfall through the accident and emergency department and provide alternatives which are out there in terms of general practice, which has remained open and is actually seeing more people than ever before during the pandemic. and at this time. We also have walk-in centres and lots of other alternatives to ED, but we also have lots of people out there who have become more unwell during the pandemic, have delayed seeing people to seek advice, and we do want to see those people coming forward, but equally we want to make sure that we recover in terms of our planned and elective care pathways. And also COVID allowed us to bring in additional metrics around our delivery of vaccination and making sure that we delivered the programme at pace and where we needed to do that. So these are all matters that have regular progress reports to our governing body, and as I said, those governing body papers are available on the website. Moving on to finance, Mark has given a very good overview of where we are in terms of finance. He's covered it off very well. We have always engaged very prudent financial management, and particularly so during the pandemic. Very early on, when we went into the incident response, and the Chancellor said along the lines of by whatever means, we were also cognizant that by whatever means does have parameters in which you can operate. So everything we spent in terms of the pandemic was documented. It went through a business approvals process, so we could account for every penny, and so we could make sure that we spent the public money effectively, efficiently, but also with cognizance of due diligence around that. Mark's also highlighted that all the statutory performance targets have been met, and we produced a small surplus, which is quite a challenge during a time where actually we were spending more money on direct patient care than we ever had done before in terms of additional PPE, additional services, etc. I think behind that is an excellent finance team who have received many accreditations and accolades for their work, but also a whole organisation understands the importance of finance and prudence around financial management. So really it is a whole team's approach, but it's also a whole wider system approach, because we manage our finances not just as an organisation but as a Wirral system, and that really puts us in a good place for going forward into the world of an integrated care system and operating as a place within that system. I think Mark also touched upon where we are in terms of our running cost allowance. Mark suggested it's less than 1%. It's about 0.82% of our money is spent on management costs, which is I'm proud it's so low, because that means that 99% goes to patient care. But that means we have a very small team. And Mark also highlighted during the last year we took on additional responsibilities, particularly around primary care, with no additional resources to manage them. We absorbed that, and we also absorbed the additional responsibilities that COVID and an emergency response brought with it. But as I'll go on to later, that didn't mean we took our foot off the gas in terms of improving services, in terms of strategic developments, nor did it mean we didn't maintain our essential governance to make sure we operated within the law. Quality, again, has been dominated by our response to COVID-19, but again, we've worked with our providers of services to make sure that quality is key in all we do. It's the driver behind what we want to see happen, quality services delivered in a timely manner for our residents. And we recognise that doesn't always happen, but we make sure we intervene and work with our providers when it doesn't, to rectify, respond and learn. We've maintained our quality review visits and meetings with our providers. We've worked with our partners around consistency of care in the care sector, also in increasing rates of vaccination within the care sector, and also looking at infection prevention control measures and improving them. We've also maintained our work around safeguarding adults and children, which has been absolutely essential during the last 12 months, particularly during the period of lockdown, where much could have been unseen had we not worked with our partners in the police service, the local authority and others to maintain our focus on safeguarding, but also on things like special educational needs and disability services. Clearly, because we were in a period of lockdown and because society has changed, we've had to look at new ways of engaging with our population. We've made good use of social media, but also we've used face-to-face contacts wherever possible and wherever safe to do so. One of the vaccination programme has given us an opportunity to get out with, as Paula said, the vaccination bus, and to connect with communities in areas of socio-economic disadvantage, which are usually have been the areas with low vaccine uptake. And working with our partners in the council, particularly the public health team, but the whole council, we've been able to make sure that we get messages out, health messages, pick up information from local people, but particularly working with people, as the annual report says, working with Wirral Change, the Dean Centre and Wirral Multicultural Organisation to tailor messages for the minority ethnic groups within Wirral, who very much in the early stages of COVID were hard hit, disproportionately hit by the pandemic, and therefore we needed to make sure we got the vaccine to them in an appropriate way that met their needs. Paul has already, I think, spoken about tackling inequalities, which again is a key driver for us. We all know about the inequalities that exist within Wirral, between east and west, within pockets within each of our wards and parts of our borough, but also across particular groups. So COVID-19 has particularly hit people with mental health needs, people with learning disabilities and autism, children and young people. As in those areas, we're seeing increased need for mental health services and interventions. So the inequalities issue remains a big challenge for us going forward, and is absolutely at the heart of what the integrated care system is going to be about, which is actually tackling inequalities and working with our partners to in terms of economic and social measures to do that. Next slide, please. So in terms of key strategic developments and service improvements, as I said, I've touched upon this, and it's not just been COVID. It's quite striking that the largest proportion of the annual report in terms of what we've done, rather than the legal stuff we need to put in, actually deals with key strategic developments. So just going through them, in terms of learning disabilities and autism, we managed to keep our numbers of children, young people and adults who are inpatients at a very, very low level, reducing admissions. That's because we've worked with our local authority and other partners to put in good community services that intervene in terms of intensive support and that avoid admissions. Now, we're by no means there where we need to be on that journey, but we're doing that journey together around improving those services. COVID has provided opportunities for improving our respiratory services. So the delivery of COVID oximetry at home has encouraged more self-care. It's encouraged more monitoring through non-face-to-face means, and has increased the reach of our community respiratory services. We've also undertaken improvements around diabetes care, palliative and end of life, and again particularly acknowledge the contribution of Wirral St John's Hospice and others during the early stage of the pandemic, where people were on end of life journeys more than they are now. We've also improved our connection in terms of maternity services, so responding through the quality team to the Ockenden review arising from the Shrewsbury and Telford Hospital Trust governance review, and making sure that with our local hospital we've embedded the learning around that and putting in place systems and processes to address that alongside Wirral Maternity Voices. I'm very proud of those local maternity services who have, certainly my time in Wirral, been very innovative and very engaged in the programme around improving care for women and children in our borough. We're introducing new services for long COVID and have been acting as the lead for that across Cheshire and Merseyside, bringing people together on that issue. Our Director of Commissioning, Nesta Hawke, has also been working on bringing together people around obesity services, and also within Wirral under the auspices of the Health Inequalities Group, doing more around alcohol services, as Alcohol, particularly during lockdown, consumption has increased, and therefore harm from alcohol has also increased, and we're seeing that coming through now into acute services as well. We've also maintained work around our cancer services and our effective support around that, making sure that the referral assessment for suspected cancer 2-week referrals is maintained, and again working with hospital partners to make sure that people are on those pathways swiftly when it is needed. In terms of mental health services, we've done significant amount of work in partnership around crisis care, and a crisis cafe has just opened up in Birkenhead, which again we're really proud of the partnership there between Cheshire Wirral Partnerships and the Spider Project within the borough. And I think also we've made sure that we've led on many of those issues around perinatal mental health, improving access to psychological therapies. There's, we could go on in terms of the work we've done, and I'm really proud of the commissioning team and all those who support them in business intelligence, in finance, and in corporate services, because it's very much been a team effort. We have managed to negotiate our way through a pandemic. As I said, still in it, but we've managed to work as a system with partners around that. We've managed to continue developing services, and as I said, with a very small team of people and with a very proactive and productive team of people who've had to also cope with work going into their home, because much of this has been conducted through Teams meetings rather than face-to-face in office environments, although we are moving back into those environments now in a socially distanced and controlled manner. Moving on to governance, there's a big section obviously in the annual report from page 47 onwards about governance, but again we have managed to maintain all of our governance throughout this process. We have not stood down any committees, so quality and performance, finance, primary care commissioning committee, audit, remuneration and governing body have all continued throughout this period. Have all received regular reports on how the system is doing and also intervened when necessary. I'd like to thank all the members of those committees, but particularly the lay members, to Leslie, to Alan, Ian and Sylvia, who chair those committees and bring the voice of the public into them. And to quote Simon Stevens, so we think like a patient but act like a taxpayer. Think like a taxpayer, act like a patient. Anyway, one of those things. But just thank for their support there. But also below those committees, we've made sure that we've achieved the highest levels of assurance, as Mark pointed out, with our auditors. We've made sure that we've intervened, not just monitored, but intervened in regard to serious untoward incidents, as the document points out. The corporate services team have, I think, through the complaints and FOI work, managed a huge volume of patient and public inquiries, not just complaints, but inquiries about how to get care, directed people, huge amount of effort in that. And also, particularly during the early stages of the pandemic, a lot of contact with elected members, both councillors and MPs, which we really welcome, because elected members, whether councillors or MPs, can be, if you like, our canary in the coal mine. They can often tell us when things are not where they need to be within our system. And certainly in the early stages, many of our local elected members were highlighting the shortages around personal protective equipment that care homes and caregivers were experiencing, which enabled ourselves and principally the council to respond to that very, very quickly. So again, a very, very good team looking after the governance. I talked a bit earlier in terms as we go into partnerships and Wirral as a place. We very much are, I think, a team Wirral that has emerged over the last 3 or 4 years very, very strongly. And we see ourselves very strongly as Wirral rather than a set of organisations who sometimes get in a room together. That is going to be our strength as we move into the integrated care system, which begins next April, but for which we're preparing now, preparing that governance. We have really good working relationships and personal relationships with people from our partner organisations, and we're not afraid to have difficult conversations with one another, but to do so that's in a very constructive way and about how do we solve these problems, how do we address things together. We've got many mechanisms for that in place. So we have worked in a strategic partnership with the local authority, with Wirral Council, for about 4 years now, and we have various mechanisms through which we govern that. Section 75 of the NHS Act 2006 enables us to pool budgets and resources, and I was told last Friday that we have the highest amount of pooled resources across the whole of Cheshire and Merseyside as a proportion, which is excellent, because that's what we should be doing, is making sure resources go to where the care is needed. And also we have COVID put in place a system whereby meetings happen daily across the system with partners, but it's about how we work as one, which is absolutely our strength going forward. So finally, this leads into the policy context, the emerging policy context, which is we have a health and care bill currently going through Parliament. It proposes that the clinical commissioning groups will be dissolved on the 31st of March 2022. So subject to legislation, this is probably our last AGM. But it's the beginning of something else. It's the beginning of Wirral being a very strong place within a new integrated care system. And just to explain what an integrated care system is, it's got 4 components. There's an integrated care board, and the integrated care board is a statutory board which will govern the NHS contribution to an integrated care system going forward. The Integrated Care Board will be the place where the staff from the CCG will transfer to, where our functions, responsibilities and resources will transfer to, and will be the statutory body that replaces the 9 CCGs going forward. And we're currently in a process of transfer, close down and due diligence to make sure that happens effectively. So the 9 organisations shut down on the 31st of March, and the new one stands up on the 1st of April. And it is a seamless process with minimal disruption. So that's the Integrated Care Board. The second component of an integrated care system is the Integrated Care Partnership. This is where really important strategic goal setting and accountabilities will be held with our local authority partners and the NHS on a Cheshire Merseyside level. And the exact nature and shape of what an integrated care partnership will look like is still to be determined. It's still subject to further guidance. We know what an integrated care board will look like because there's guidance out there at the moment, and we will soon as a system be going out for engagement on what is in the constitution for that, which will include what the senior executive directors look like and the other nature of the board. So they're the 2 statutory bits, the Integrated Care Board, the Integrated Care Partnership. The third component is our place-based partnerships. And this is where the Integrated Care Board will work alongside local partners, whether they be providers, the local authority, the not-for-profit sector and others, in developing partnerships that ultimately will allocate, receive a resource allocation, deploy that allocation, deliver services that meet particular outcomes, but just as important, in fact probably more importantly, start to tackle some of the inequalities that those particular places face, to do so by harnessing the economic, social influence that local authorities and others can bring, and really starting to tackle the key determinants of health. Colleagues in public health will tell you that it's only, in terms of a person's life, it's somewhere between 10 and 20% of their life that health and care services can influence. The rest is about where they live, where they work, how much exercise they take, etc. and this gives us a real opportunity to work on those things. As somebody said the other day, would you undertake a change? You know, this is a very strange time to undertake a strategic change in terms of the leadership and transfer of functions in the NHS. And somebody else said this is the biggest opportunity we have to shape a generational opportunity to shape how we deliver care going forward, because this is about integrated care systems, about bringing people together seamlessly. And both are right. Both are right. There's a strange time to do it, but there's no good time to make a change. However, I'm more in the latter camp, where I think this is a great opportunity to, particularly for Wirral, where we can build on those partnerships, we can build on the solidity that we have brought as a commissioning organisation, certainly in the last 4 or 5 years into the system, and build from those strengths and be a strong place as Wirral within that wider integrated care system. So the 3 things we are doing in terms of looking forward, although looking forward is for the next 6 months, we will be supporting our system partners as they face the challenges of a COVID present environment, as they try to restore services, and as they face demands on their services, the like of which we've never seen, whether through an urgent and emergency care route, or whether through needing to deal with elective backlogs. But equally, recognising that's not just the hospital, that's mental health services, learning disability services, our community services, and primary care. Primary care has probably never been busier than it is at the moment. People are wanting to see their GP, and there's a range of means by which they can access their GP, but you know, the demand is there, and we're cognizant of that. So supporting the system. Secondly, maintaining our statutory duties. I know I've just said that, sorry, I should have said next slide. Thank you, Mike. So the second thing is the maintaining essential governance and business activities for the organisation. We, until the 31st of March, we are still the accountable organisation as NHS Wirral CCG. I am still the accountable officer, accountable to the Secretary of State for whatever happens in the health and care system in Wirral. And that I'm fully cognizant of. I am preparing for the future. I do have an eye on how we transfer our functions, people and other resources to the Integrated Care Board, but we also have to manage the present, and therefore we have to make sure that essential governance and business activities are there. How we deliver that's going to change in the next few weeks. There's the proposal that we start to do more jointly with other CCGs, but that doesn't mean we neglect or abrogate our responsibilities in regard to Wirral as a place and essential organisational governance. And as the slide says, the third thing is the delivery of close down of the CCG and the transfer of functions, people and other resources to the proposed Integrated Care Board. This is something that people haven't done for about 10 years now. The last reorganisation in the NHS was sort of triggered in 2010 and happened officially on the 1st of April 2013. We had a good 2 years to go at it. Here we've had probably 6 to 9 months. So what we're trying, we are learning as we go, but we are backed up by some really good people in terms of giving us the list of the things we need to do and the things we need to transfer, and to make sure in doing that, the first 2 issues, in particular the first one about delivery of care, we don't lose sight of that as we go forward. The essential thing is keeping the system running, supporting our system partners, for which you do need good governance and good structures, and but you actually need very, very good relationships that are built on trust and they're built on being supportive and collaborative. So I will have been with this organisation for around about 5 years at the end of March next year, and I'm really proud to lead, to be the chief officer of this organisation. And I've seen in my time here people grow and develop, and that's enabled the organisation to grow and develop. And I think they're the things that have helped us get out of directions, to be recognised by our peers in the system and by NHS England Improvement as our regulators, as people who not only want to do the right thing but are doing the right thing in the right way, and also a group of people who are ready to embrace that future of being part of the Integrated Care Board, even though we still don't know the full detail of what that might look like, because that is emerging over this next few weeks and months. But as I said, thank you to all the staff, to the member practices of the CCG, to our system partners within Wirral and beyond, because this has very much been the last few years a team effort to get from where we were to where we are now. And I think we're in a far better place now, despite the pandemic, to crack on and to improve services for our population. Thank you.
So thank you, Mark and Simon, for those excellent overviews of not only our own organisation, but also our wider system. So if we just have the final slide, please, Mike, thanks. And despite our digital maturity, unfortunately, Simon did have a slight technical glitch at the start, but these things happen when you're doing things remotely and digitally. Simon raised a couple of things that I'd like to touch on just in closing remarks. He talked about our system working, which both Mark and I have referenced also. And I think that system working has been demonstrated, as Simon said, over the past couple of years, but particularly in the past 18 to 19 months, in how we've come together as a system to address the greatest challenge to the NHS and to our system and to our nation in terms of the COVID pandemic. But also as we strive to improve health and care delivery in Wirral, in our borough place, and then how we will link into the ICS as time moves forward. Working with colleagues across the system has really opened our eyes to how we can do things in a different way. And I referenced the third sector and working with patient groups as being really crucial in how we listen to and understand lived experiences and how we can take that forward in our delivery. And also working with our local authority and elected members. And I am proud and privileged to have regular catch-ups with with Councillor Yvonne Nolan on a regular basis in terms of how we can continue that working. Simon also referenced care in terms of mental health delivery, and I just want to highlight that Campaneros, which is the crisis cafe, will be is opening here in Birkenhead and has an open day tomorrow. The other thing that Simon referenced was in our tackling health and care inequalities. One of the subgroups that we have is the alcohol subgroup, and that's chaired by Nesta Hawker, our Director of Commissioning. And we have seen an increase in alcohol consumption throughout the pandemic, associated with a number of different conditions, associated with physical health conditions, people feeling isolated, people feeling lonely. But in terms of how we support our residents through that, we have launched the Lower My Drinking app, and we would encourage people to download this. It can be done anonymously if people are concerned about that, and it's something that we would encourage all of our residents to look at and to engage with. Simon also referenced continue to reference our engagement across our partner organisations and the fact that we have developed and strengthened those conversations that we have, and we're not afraid to have difficult conversations. And I quote my late father when I say we can agree to disagree without being disagreeable, and being able to unearth those differences and those issues that that come up, being able to put that out there on the table and have those conversations and really recognise that it is okay to have differences. It's how we use that and how we use our strength of character and our strength of system to take that forward. So at this time, we would ordinarily in a face-to-face meeting have welcome questions from you, our public, from the audience, and have discussions and debate around that. And we did ask for questions, but by close of play on Friday, which was the closing date for submission of questions, there weren't any submitted. But there are just a couple of things that I would like to raise and so to speak, take the elephant out of the room. And Simon touched on it slightly, and that was around access to GP appointments. We know, and we can't turn on any media outlet now at the moment without hearing about the pressures across not only our system in terms of, Simon referenced the emergency department, but also primary care. And there has been a lot of negative press about access to general practice and the inability that is perceived among some people in terms of accessing face-to-face appointments. There is huge demand in general practice, and I have been a GP in Wirral for over 18 years, and I've never known the demand and the pressure as it is at the moment. And I'm hugely supportive of all of my GP colleagues across Wirral in the sterling work which they have done throughout the pandemic, because general practice has remained open throughout the pandemic, but also now as we're coming out of the pandemic, hopefully, but we know that we're facing into a difficult winter. And as we work across our system in conjunction with our colleagues in community, in mental health and in secondary care. Although there is a key media focus on that face-to-face appointment, we have to recognise that times are changing and that the delivery of health and care is evolving. And so there are multiple different ways of accessing care, health and care. And so the traditional model of a face-to-face appointment doesn't necessarily suit everybody. And so we're looking at various different ways of doing that in terms of both face-to-face, telephone, remote, video, e-consult, etc. What I will assure you of, however, although there has been a sense within the media that general practice has been closed or that there hasn't been any appointments, I can assure you from reviewing our data that over 700,000 appointments with general practice were offered and made between January and June of this year. That's 2 appointments per Wirral resident. And in September alone, 160,387,000 appointments were offered in general practice, which is 12.7% greater than in September 2019. And that is a blend, that's a hybrid, that's a mix of different appointments, both face-to-face, telephone, video consultation, and using digital platforms. So please be assured that general practice is open, that general practice are willing to and more than happy to manage and see and care for our residents across the system. And so please just be assured by that. We are coming into a difficult winter, as I said, but it doesn't mean that we aren't open, that we aren't accessible, and we certainly are. I think the other thing that Simon mentioned there in quite a lot of detail is our transition, the move from where we are as a CCG and that the CCGs will close, and I referenced it also on the 31st of March, and that we are moving into more place delivery at a borough level under the umbrella of the integrated care system. And we are supporting our system, we're supporting our colleagues here in this organisation as we transition through. But please be assured of our absolute sterling commitment to this organisation up until the very end of the 31st of March of next year. I echo what Simon said in that I am hugely proud of this organisation. I said earlier, I'm proud of the people I work with and to work within the organisation. I have excellent colleagues here, and we have an excellent team in NHS Wirral Clinical Commissioning Group. And I again applaud them for the work that they have done under very, very unusual and difficult circumstances, but also to all of you, to our public, to our residents who have embraced the changes that have been thrust at us through this COVID pandemic and who have done so and embraced how we deliver health and care. I thank you all for attending today. I hope that you have found it useful. It has been an unusual AGM again, as it was last year, and as Simon said, that this is our last AGM. I feel privileged to have been able to deliver the AGM now over the past 3 years, and I look forward to what the future may bring to us. I will end the meeting now. I hope you have a good afternoon, and remember to stay safe. Thank you.